Thank you, Dr. Brown, for joining us today. It's such a pleasure to have you with us. I'll give a little bit of brief background on yourself. Dr. Brown is a triple board certified sleep medicine physician and pediatric pulmonologist. She helps families, including parents and their children, sleep to achieve optimal health, thrive, and live to their fullest potential. She completed her medical school training in Nigeria, followed by her residency in general pediatrics in New York, where she was awarded the Excellence in Pediatric Pulmonology Award. She then went on to a fellowship in pediatric pulmonology at St. Christopher's Hospital for Children, where she was appointed as a chief fellow. After working as a pediatric pulmonologist and medical director for a few years, she realized a significant overlap between sleep and breathing issues in children. This motivated her to pursue a sleep medicine fellowship at the University of Pennsylvania. As a sleep medicine physician passionate about educating families on sleep and recognizing the negative impact of insufficient sleep on mental health and wellness, she founded RestfulsleepMD, providing education and consultations to families and organizations to address sleep issues. She is a member of the American Academy of Sleep Medicine and the American Thoracic Society and has co-authored several peer-reviewed publications. She is on several medical advisory boards, including Project Sleep, Baby Center, as well as Primasun. Dr. Brown is a frequent speaker at conferences, summits, and association meetings nationally and internationally. She also works with organizations to improve employee health by incorporating health sleep into their wellness journey. Overall, we will just have this enlightening session of the importance of sleep, where we will delve into the critical role sleep plays in maintaining overall health and well-being. The science of sleep. Dr. Brown, what are the different stages of sleep?
Yeah, thank you so much. And thank you for that kind introduction. So when we talk about the different stages of sleep, I want to kind of start through the different cycles. So we cycle through light sleep, deep sleep, and what we call REM sleep, or rapid eye movement sleep. So light sleep is kind of broken into stage 1 and 2. And then deep sleep is what we call stage 3. This is where you have more of a slow wave sleep. And then the third or the fourth stage is REM sleep, or rapid eye or dream sleep. So those are the main sleep stages that exist.
Fantastic. Thank you for sharing that, Dr. Brown. How can disruptions in the sleep cycle impact our overall health?
Yeah, so, when we cycle through these stages of sleep, it doesn't mean like you're going from stage 1 to 2 to 3 and then REM sleep. Not necessarily. It's not perfect like that. So typically what happens is that, you as you're sleeping, you kind of get drowsy, and then you get into usually very short period of time, you're in the sort of lighter stages of sleep, and then you get into slow wave sleep or deep sleep. Now, if you have anything, whether it's environmental factors, whether it is internal factors, maybe a sleep disorder, insomnia, you're hot, you're cold, it's noisy, what that does is it doesn't allow you complete that cycle completely. It kind of kicks you most times out of that deeper stage of sleep to a stage where it's a little lighter. So if you think about, maybe for instance, maybe you had tooth pain, or you were just uncomfortable, you had a headache, you find out that you are in a stage where you seem to be a little bit more aware of your surroundings compared to when you had really super peaceful sleep. So what that ends up doing, if there's something going on, again, whether it's internal or external, it moves you from deeper stages, which is what we feel is a much more restorative stage of sleep, into lighter stages. And then over time, of course, we know that can contribute to negative health consequences.
And that leads us kind of into, does good sleep contribute to our improved memory and our cognitive performance?
Yeah, so there are different ways by which this happens. So we have a system in our brain. It's called the lymphatic system. It's similar to the lymphatic system in our bodies. So the lymphatic system is how, your body kind of gets rid of like waste products. So we have a similar system in our brains called the G lymphatic system. Now, when you get into more deeper stages of sleep, what happens is that the channels of that lymphatic system open up. And so it helps with washing off essentially waste products, okay, which your brain may have accumulated over the period of wakefulness. And so what that takes away is, just more of that mental fogginess you might have, and improve your attention and memory, improve your learning and cognition. If that lymphatic system is not working effectively, either because you're not sleeping well or you're not really getting that deep sleep, is what happens, especially with sleep deprivation, is there's a buildup of those deposits on the surface of your brain. And we've seen, studies have shown that there's a higher likelihood of developing conditions like Alzheimer's. And they've actually looked to see for people who have Alzheimer's, what are some of the products that they see from biopsies and things like that. And it is the same as some of those waste products that your brain is not able to get rid of. So stuff like, beta amyloid, for instance. So those things definitely will contribute to, long-term consequences. And you can see that even from the start, like you're forgetting, like someone I was seeing, I actually saw today says, well, I take, I don't know, my umbrella and I assume it's my car key. Like you're already making poor associations, even with 1 or 2 days of poor sleep. And then over time, that just tends to get worse.
So along the lines of that, something I'm kind of interested in is adequate sleep. How does that help, and does it help in maintaining a healthy weight and maintaining healthy metabolism?
Yeah, great question. So we know that when we sleep, we have our hormones get regulated, and they're different hormones. In fact, there are few hormones that regulate appetite to start with that can impact our metabolism. So two that straightforward come to mind are what you call ghrelin and leptin. So one of these hormones, especially leptin, is what we call the satiety hormone. So it's the hormone that lets you know you're full. Ghrelin is kind of like the hunger hormone, which lets you know you're hungry. And so when you don't get good sleep, over time, you almost get like a flip of those hormones. So your leptin is now low and your ghrelin is high. And so to start off without really sleeping well, even from just a few days of poor sleep, you feel hungrier and you crave more, carb containing foods, highly sugary, high fat things, because again, your brain is trying to conserve energy. You realize there's a deficit because you're sleepy. And so you may start to move more towards again, those sugary meals, those meals that will give you like a quick jump in your sugar right away. And we've seen that that's a real consequence of this hormone regulation. And the satiety, the feeling of fullness is just not there. And so you tend to take larger portions. Another thing that we know with metabolism is hormones like insulin are regulated during sleep. So if you have poor sleep, you're more at risk for dysregulation or abnormal regulation of insulin, which puts you at risk for things like diabetes and things like that. So over time, you may start to see that impact. And so we've seen increased risk of obesity, increased risk of type 2 diabetes, increased risk of hypertension and things like that, because you have this dysregulation of hormones. And one other hormone that we see that's really not well regulated if you have poor sleep is cortisol. So cortisol is a stress hormone. So when cortisol is high, again, that takes a lot of toll on the body and overall will affect your metabolism.
Fantastic. Thank you for that information. I'm always interested in how our metabolism works and how sleep, something as simple that we take for granted as sleep, can have an effect on that, because we don't always think along those lines. So thank you so much for that. Can you tell me what, some common symptoms are of insomnia, and how can we treat those ourselves as individuals? That a lot of us do have trouble with sleeping and falling asleep and all of that. And we laugh, we talk about counting sheep and things like that. But on a serious note, like, are there symptoms that we can look for, and are there ways that we can treat that? Just interested in that.
Yeah, no, that's a great question. And insomnia is very common, even in the United States, all over the world. So really, insomnia is defined as difficulties falling asleep, staying asleep, or early morning awakening that's resulting in daytime consequences. And there are different types of insomnia. There's acute or situational insomnia, and then there's chronic insomnia. So what's situational or acute insomnia? You moved, you traveled, something stressful happened at work, loss of a loved one. It happens, maybe, you have sleeping difficulties for a short period of time, and then you go back to sleeping okay. And, you recover. It's a little bit rough, you recover. But for chronic insomnia, which most people tend to struggle with, this has been going on usually for at least 2 or 3 months, and you're having symptoms at least 3 nights a week. And it's been going on for about 3 months or so. And, the symptoms really you're looking out for, again, is that classic, I can't fall asleep. Sometimes people will say things like, I'm exhausted. My head hits the pillow and the light switch comes on. And so people tend to have just a really hard time regulating. You start to feel frustrated. You may end up on your phone. You're trying to conserve energy during the day, and it does impact mental health significantly. It does impact, metabolism and all these other things we talked about, memory and things like that. So what are ways to treat insomnia? There are really 3 main ways. There are lifestyle factors that you can use to address it. So what are some of those? Healthy sleep hygiene, which we always talk about, right? Not bringing your phone into bed, turning out the lights, avoiding caffeine, avoiding alcohol, exercise during the day. Those general lifestyle tips can help, but they're very limited, especially if you have chronic insomnia. The second, which is more or less the first line, I would say, or the gold standard, is cognitive behavioral therapy. This usually is a series of exercises or activities that are addressing thoughts and behaviors as well as beliefs around sleep. So we do things like what we call stimulus control, where we're advising you to avoid laying in bed for excessive hours looking for sleep, right? Or things like, what we call sleep restriction, where you might need like a narrower sleep window until you're able to sleep, and then now you start to extend your sleep. Things like, of course, the psychoeducation, which is really a lot of understanding how sleep works, avoiding naps during the day and things like that. So it's a whole program that can be done online. So there are CBTI programs. It can be done through apps. There's some CBTI apps. It can also be done, of course, with people like myself or a sleep psychologist or a therapist who has special training in cognitive behavioral therapy. So usually once you start off with some of the apps and some of the online programs, if it's not effective, usually what we'll encourage is you should probably do more of a one-on-one. Usually it's about a 6 to 8 week session of CBTI. It's gold standard. It is highly recommended by the American Academy of Sleep Medicine, and it's effective. And then the third treatment option is, medications, right? So there are some situations where you might need medications. Usually we recommend should be on the short term to help with sleeping. Now, the issue with medications is many times it can be used for a short time, but I've seen people who have been on sleep medications for 20 years. And now we're getting a lot of research that those medications actually have significant side effects. So even if you're using medication, it's more of a bridge until you address the root cause and you really start to incorporate the right strategies to improve your sleep.
Fantastic. Yeah, my doctor always tells me, a lot of times medication is that last step that you want to take, you want to try exhaust all other options before you go to that route. So that's good to know. How can relaxation techniques like medication or deep breathing, etc., aid in better sleep for folks?
Yeah, great. That's a great question too. So relaxation strategies have a lot of benefits. In fact, during your process, if you're doing CBTI for insomnia, one of the core ways we address it is through relaxation strategies, and there's so many of it. Number one is relaxation will decrease stress and anxiety, which tends to be the major driver to insomnia and sleep issues, right? Your mind is racing, you're worried, you're stressed out, you're anxious. All those things are counterproductive when you talk about sleep. So relaxation is a big one, right? Whether it's deep breathing, whether it's meditation, whether it's listening to a sleep or calming podcast, whatever that looks like, progressive muscle relaxation, there's so many options. So it decreases stress and anxiety. The second thing is it decreases your heart rate and slows down your breathing, right? If you notice when you're anxious, your shoulders are hunched up, your heart is racing a little bit, you're breathing a little bit faster. We need all of those things. We need the opposite for you to sleep. So when you get to that state of relaxation where you're really exercising, being present in the moment rather than like way ahead of you, it helps to bring that down, and that helps to promote sleep. And then other things like, mind, that's that concept of mindfulness, right? Relaxation, meditation, those are types of mindfulness practices. And what that does is, again, it's taking you from where you are, which is either in the past around things that happened the day before, the year before, the month before, since you were born, or you're in the future, what's going to happen? What am I going to eat for lunch tomorrow? What emails I need to send? How am I going to pay the bills? It takes you from either the past or the present and brings you to the present moment, right? And so what that will do will also allow you to let go, right? You can get to that state where you can say, well, I really don't have control of the future. I don't have control of the past. It's happened, and I'm willing to let go. So when you get the right relaxation strategies, it can actually help with that. And when you let go, is when sleep comes. Like, sleep doesn't come when you're trying to white knuckle and you're stressed and desperate. So when you get to that state of getting out of your own way through relaxation, it promotes good sleep.
Yes, I agree. Going to bed stressed and with your mind racing definitely does not promote good sleep. That's for sure. We had a great question come in from Q&A. If someone is dreaming almost every night, does that mean they're getting good sleep? Do dreams correlate with good sleep, Dr. Brown?
No, not necessarily.
Okay.
I wish.
Okay.
Some people don't really,
yeah.
yeah. So because then it would be a good way to say, okay, we're getting good sleep or not. What helps you know if you're getting good sleep is you listening to your body. How do you feel when you wake up?
Yeah.
How do you feel during the day? Are you sleepy? Are you drowsy? Those are more of a sign of whether you're getting good sleep or not. Now, if you're at the point where you're dreaming a lot and you're waking up tired and you're tired a lot, you might actually have a sleep disorder. Because what that means is the reason why you're dreaming and remembering your dreams is because you're probably waking up at the end of your sleep cycle. And so if you're waking up at the end of your sleep cycle, why are you waking up so frequently that you're remembering your dreams and you're dreaming so much? So when it's that situation, especially if you're tired or you're not refreshed after getting enough sleep, it might be time to just get evaluated because it could be sleep apnea.
Mm-hmm. Okay. Awesome. Thank you so much. So as we have about 8 minutes remaining in our time, I want to just put one more question out there. How do you feel creating a sleep-friendly environment contributes to better sleep? And I know myself, like I have a sound machine in my bedroom, and that has really helped. So how do you feel like creating those types of environments can really benefit and contribute to better sleep for people?
Yeah, that's true. I don't have a sound machine, but my own thing is a sleep mask, right? So everybody has their thing that helps. And I would say keep going with that. So one of the things you want to do with your bedroom is you want to create I call it a sleep sanctuary, right? Somewhere that you look forward to coming to, a place that feels safe and welcoming. And there are really three things you want to pay attention to when it comes to creating that sleep sanctuary. You want it to be cool, you want it to be dark, and you want it to be noise free. Those are the basics. Everything else is fluff, which might help, right? So cool, the reason why is because your core body temperature drops as you're going to sleep. So when you have a room that is dark, it actually helps promote your brain's melatonin production. So it stimulates melatonin production to say, okay, melatonin is that sleep hormone, or what we call the hormone of darkness. So if your room is too brightly lit, it actually tricks your brain to think it's daytime. So when it's dark enough, and what would you need to sleep to make sure it's dark? You may need sleep. You may need blackout shades for your or blackout curtains. You may need a sleep mask like I do, yeah, right? You may need to just make sure you eliminate any external sources of light. I think that's really important. The second thing is you want your room to be cool, right? Cool because a drop in your core body temperature actually facilitates sleep. So dark, cool. And so you really want to make sure you set the thermostat, relatively lower than the rest of the house. It doesn't have to be frigid because if it's too cold now, you're not going to be able to sleep. Especially, and I also always talk about, because I work with a lot of women in perimenopause and menopause, when you're getting all the hot flashes and everything like that, that's a big sleep disruptor. So you want to pay attention to that. You may need an external fan. You may need breathable beddings. So those breathable beddings, sort of moisture wicking in case you have those night sweats. You get that, it doesn't stick to your body as much, right? And then you also want to make sure it is noise free. So if you have a snoring spouse, if you have noise outside, that's where either, earplugs work, or like you use a white noise machine, because it kind of blocks out the noise. So those are just some things to set up the environment.
I really checked off a lot of lists. I have the darkening curtains, I have the noise machine, I have a fan, and I have the sheets. So I'm set. I must be sleeping good.
You have
No
no
doing something right. I have no reason not to sleep. So if I'm not sleeping, I don't know what's going on. So yeah. Well, Dr. Brown, as always, it has been such a pleasure to talk with you today and get such great information on something that, like I said earlier, I think we take for granted, which is sleep. I hope everyone that's joined today has gotten this great information out of this, as I have, about my health and well-being. As far as sleep goes, again, taking it for granted. I think sleep is one of my favorite part of the days. It's the one time that my mind can shut down and I can relax. So we really appreciate all the attendees today. And Dr. Brown, thank you again so much for bringing your expertise and answering the questions and giving us some insight to our sleep, which is just so very important.
Yeah, absolutely. Thank you so much for having me.
Thank you. It's been a pleasure. Enjoy the rest of your day. Thank you.